Good afternoon and welcome to the House Health and Government Operations Committee for our hearing on Senate bills that have crossed over from the Senate. We apologize for the tardiness, but we're now at the point in session when the schedule is in flux and will change on a daily basis. So if you are watching for subcommittees or bill hearings, I would recommend that you keep track of what's going on via the website under the meetings tab. With that, we welcome you to our hearings today and remind you that these are we are using technology that sometimes glitches, and we ask for your patience. There are a number of bills that have cross files in the House. Those bills we will only hear from the sponsor. In bills where there is not a cross file, we will hear from a sponsor and the sponsors panel. We are, each of the sponsors get 5 minutes to present their bills. And any other witnesses get 2 minutes to present their bills. Committee is very familiar with the asking one question per panel. So that would be the sponsor and the sponsors panel with one response from the panel. With that, we will begin today with Senate Bill 654. This is Senator Klausmeier. Veterans Affairs Communications, Outreach, and Advocacy Program, Veterans Advocacy and Education Act. This is an identical cross-file to House Bill 279, which had a unanimous vote in the House. Welcome, Senator Klausmeier. Would you like to tell us about your bill?
Oh, thank you, Delegate Collison. And do you want me to talk real slow? I'll take up the 5 minutes.
That is
now I'm going to go very quickly for you. Senate Bill 654, Veterans Affairs, Office of Communication and Public Affairs, Veterans Advocacy and Education Act. Senate Bill 654 is identical to House Bill 279, which was approved unanimously both in committee and on the House floor. I'm here to answer any questions you may have. And basically, it just changed, it added a word to what is actually going on with the Veterans Commission. So,
thank you very much, Senator. Are there any questions from the committee? Please raise your virtual hands. Seeing none. That concludes the hearing on Senate Bill 654. Thank you very much, Senator, for
being with us today. Delegate Collison, give me a call or I'm going to call you. I need to talk to you later.
Okay, sounds good. Thank you. We will move to Senate Bill 708. That is Senator Lamb. And this is Maryland Department of Health, Office of Inspector General. And we have 2 speakers on this bill. We'll start with the sponsor, Senator Lamb.
Good afternoon, members of the committee. Senate Bill 708 is a response to clinical concerns that have been brought forward regarding the state's mobile vaccination program by an internal departmental whistleblower, Dr. Jessica Ray, and the retaliation she experienced within MDH as the result of her coming forward. Dr. Ray has been serving as the department's COVID response and recovery efforts since the pandemic began. She previously served as a chief safety officer for community testing, as the clinical advisor for testing operations, where she helped design the testing tent behind the house that we still use today, and eventually as the Mass Vax chief clinical advisor. She has a doctorate in health sciences and has been practicing as a physician's assistant for 14 years. The concerns brought forward by Dr. Ray concern the department's mobile vax program, which was stood up after the mass vaccination sites began winding down last year. These mobile vax sites were smaller pop-up-like clinics, bringing the vaccine to the underserved, harder to reach, or less mobile populations. There were 2 types of mobile vaccination clinics, those operated by the companies that were contracted by MDH, and some by organic sites operated by MDH employees who administered the vaccines themselves. Last year, Dr. Ray first brought forward concerns regarding vaccines administered by a company contracted by the state called TrueCare because of improper handling of vaccines between July and August. Specifically, that the vaccines were kept overnight in hotel rooms and cars instead of medical grade refrigerators, and that TrueCare didn't maintain adequate record keeping of who was vaccinated as required by CDC clinical guidance. TrueCare didn't possess required on-site medical equipment, and its staff were missing required certifications, such as that for CPR and COVID precautions training. And even though Dr. Ray first brought her concerns directly to supervisors and further up the chain beginning in September, they were disregarded by the department until December, when the Baltimore Sun began asking questions about who may have been vaccinated with spoiled vaccines. Dr. Ray's concerns go beyond TrueCare, however, which may only be the tip of the iceberg, and that the fundamental concerns inherent at the department are far worse and deeper and expand to other contracted companies as well. The legislature's Joint Committee on Fair Practices held a hearing last month on this issue, which I will try to summarize in brief and can go into further details if members have questions. Number one, because the overall MDH recovery operation was run by contracted employees, they have an inherent incentive to see the mobile vaccination program continue. And some of their leads even said that their goal was to, quote, stay in business despite dwindling demand so they could get paid. And so these clinics continue to this day at about $10,000 per clinic operated, when they may have outlived their usefulness, particularly when anyone who gets a vaccine or seeking a vaccine can get one down the street at a local pharmacy. But because of the desire to continue these clinics by these contracted employees at all costs, the leadership of the mobile vax program routinely overruled clinical experts, leading to skipped safety steps such as vaccinators missing necessary training and certifications, and even contractors administering vaccines to 5 to 11-year-olds who had no training administering pediatric doses. If the clinical experts that raised concerns internally brought them forward, they were routinely overruled, or other clinical experts were found who were more compliant with leadership's desires. Number two, the MDH organic mobile vac sites that were operated by the state's own personnel, not contractors, who had their own shortcomings in complying with CDC guidance, such as using untrained staff, failing to have pre-identified clinical leads monitoring safety on-site, clinical staff who may not have undergone proper CDC training or certifications, sites that lacked access to EpiPens in the case of a serious reaction, and the absence of temperature tracking. The drive to vaccinate as many people as possible led to a qualifications and safety be damned kind of mentality, with personnel untrained in administering pediatric doses, vaccinating kids, and with such inadequacy of personnel that some state employees were left staffing clinics for 15 days in a row without a break. When Dr. Ray brought these concerns to her immediate supervisors, they were ignored. And when she persisted farther up the chain, she was retaliated against with demotions, and she was taken out of her clinical role, moved into a non-existent administrative role. Her colleagues were threatened if they came to talk to her, with clear implications that others should keep quiet if they wanted to avoid trouble. To her credit, she continued to bring these concerns to light through the proper channels. She reached out to the Office of Inspector General at MDH, and after a long delay spanning several weeks, finally received word that clinical compliance concerns were outside of the purview of OIG. She also reached out to the department's Office of Audits and Compliance and received no help. Instead, she was referred to the Office of Equal Opportunity Programs at MDH. Then she was referred to the statewide EEOC office at DBM. As you can tell, she was bounced from one state office to another before she finally turned to the feds, the CDC, which has now triggered an HHS investigation, and was told by the feds a few weeks ago that the HHS investigation could take 3 to 5 years to conclude. So the bill does three things. Number one, it requires that a compliance officer be designated within the Office of Inspector General, who is specifically tasked with reviewing clinical concerns, ensuring that CDC guidance and standards of care are adhered to. Number two, it asks that OIG have the purview to investigate these types of clinical concerns beyond waste, fraud, and abuse. And number three, it requires that OIG respond within 7 days to indicate whether or not they can review the complaint any further. Not to complete the investigation, just to indicate yes or no, or that they should try somewhere else. With that, let me conclude, and I'll turn it over to Dr. Ray, who's also part of this panel as well. I want to thank her for her willingness to come forward and testify, and for her courage to bring these concerns to light.
Thank you, Senator. Dr. Ray.
Thank you. Good afternoon, and thank you, Chair Pendergrass and Vice Chair Pena Melnick, and the committee members for the opportunity to testify again in support of this bill. I also want to thank Senator Lamb and his team for working to ensure that whistleblowers are heard and better protected of Marylanders. The aim of the bill is to prevent silo dismissal of whistleblower reports applicable to the OIG's range of responsibilities. I requested this committee refer to my provided prior testimonies to better understand the several MDH recovery program issues I reported. My OIG report was meant to alert capable authority to immediately cease the continuous abuse of power that is endangering the public. However, no state authority has been willing to act on their responsibility to hold MDH accountable, and the EEO investigation recently concluded with dismissal of all evidenced violations. The OIG process was the most arduous. I did not hear from the OIG for 93 days, not even to confirm receipt of my initial report or forwarded abusive emails. So for 3 months, I had to act on faith that the OIG was working on the areas of safety, abuse, and retaliation. The delay was dangerous. If I had known that the OIG had decided to refuse investigating, I would have immediately sought other help. Waiting on them to intercede allowed continuous unsafe vaccine sites, staff abuses, and disregard of over 1,000 unaware Marylanders who had a right to know that they should have been revaccinated. As a clinician, I've been tormented for several months over my concern for the victims involved, especially our disregarded detainees who had no other vaccine options, our vulnerable children being vaccinated by untrained clinicians, and the punished MDH staff who are still rightfully afraid to report. However, I remain blocked from protecting the public since I am still prevented from operating my role, which per my contract is to oversee clinical policy and compliance of all MDH vaccine and testing sites. There are no internal advocates for whistleblowers in MDH. Every office strategized to decline, refer, or refute to protect MDH, regardless of the evidence. We need to ensure that the next obligated reporter does not endure these unnecessary barriers. Thank you for hearing my testimony, and I appreciate any questions you can provide for further discussion.
Oh, thank you very much for coming and telling us about the situation. I do have a couple of questions from committee members, and we'll start with Delegate Carr.
Thank you, Madam Chair. My question is why? Why were the concerns not initially taken seriously by MDH?
So go ahead, I'm sorry.
Dr. Ray, if you want to respond to that, that's fine.
Yes, thank you, ma'am. So many of the reports that I made were about the necessity to have certain measures in place that would provide a safe environment for vaccines to operate in. And so that might mean that we need to make sure people were trained appropriately. But those safety measures ended up being received as a block to operations. So if I needed one more day to make sure that we could launch safely, the answer would be no. So a lot of the drive was to avoid these obstacles.
Okay. Is that sufficient, Delegate Carr? Okay, we're going to move to Delegate Bandari.
Oh, thank you, Madam Chair. Thank you, Senator Lamb, for this wonderful bill. My question would be, how did the Office of Inspector General respond to you when you contacted them?
Thank you. So I initially submitted my report September 23rd. I had no response from them whatsoever, not even a reply of we've received your complaint. After the 93 days, when the EEO was checking on their investigation status, I received an email where they said that my complaint did not fit within their purview. And they cited one of their bullets about how they address Medicaid fraud. But they didn't explain to me when I requested clarity about why my report, which cited many fraud, waste, and abuse issues, why they weren't willing to address any of those, which did apply to the other bullets of what they're meant to do. So that's the only response I got from them.
Thank you.
Thank you. Delegate Johnson.
Thank you, Madam Chair. And my question is for Dr. Ray. Doctor, are there other employees still at MDH who share your concerns and may be fearful of retaliation or reluctant to come forward that you know of or that you've heard of?
Yes, sir. Unfortunately, the clinicians that are there, the ones that are willing to continue to try to make the vaccine sites compliant or safe, continue to experience the same types of retaliation. In fact, our leading clinician was recently removed of her office, restricted on her overtime hours as an individual, not the whole team, but her specifically, and removed privileges of overseeing specific vendors that the state prefers to have favoritism with. So those issues continue to occur, and she's been very honest with me that she is afraid to report because she's been witnessing what's been happening in my attempts to seek help. And it's a very real concern.
Sorry to hear that's going on. Thank you, Doctor. Thank you, Madam Chair.
You're welcome. Delegate Rosenberg.
Thank you, Madam Chair. To the Senator, why is the bill needed? Why is existing statutory protections inadequate? And will what you've done still deal with shall we say, recalcitrant agency?
So yes, I think that the bill is needed because there is still concern that OIG has, as was mentioned by Dr. Ray, come back and said that it is outside the purview of their ability to investigate. And so they kind of limit themselves to waste, fraud, and abuse. And this bill does broaden that to include clinical compliance and practice guidelines so that they can look into that. And they'll have a designated person as a compliance officer who would be able to monitor clinical programs at the department to ensure the proper compliance with that. And then lastly, with what Dr. Ray mentioned, that she did not receive a response from the Office of Inspector General for over 90 days. And then when that response came, it was that it's outside the purview of our office. We can't investigate. The bill requires the Office of Inspector General to respond within 7 days, not to complete an investigation, but just to be very clear, just to say that we can investigate or we can't investigate because it is within our purview or it's not, or that you should go to a different office with the concern. So, I think these are very real concerns that still exist, particularly as people may be concerned about coming forward with clinical concerns that still may continue there.
Thank you.
Delegate Hill.
Thank you, Madam Chair, and thank you, Senator, for this bill. And Dr. Ray, thank you very much for continuing to work with us and for coming forward. So, Senator Lamb, assuming, and you can correct me if I'm wrong, that TrueCare isn't the only company that we might have some concerns about, and that vaccines aren't the only thing, that there might be reason for whistleblowers to come forward and tell us that things aren't going. I remember how hard it was for us to get some independence into OIG. In the bill, you talk about the compliance officer and charge them with ensuring that best practices in healthcare, public health, government administration, laws and regulations, and department policies are followed. I don't see where the bill gives them the authority to do something if they discover that it's not. So how do you envision the compliance officer, if they see that part of MDH is not a compliance, other than saying you're not in compliance, how can they actually leverage some authority to make them come into a compliance?
So the Office of Inspector General's purview will be broadened by the bill, and I can get you the exact language that's in the bill itself to cite that. But I think on page 3 of the Senate bill, it says that the Office of Inspector General, along with the compliance officer, paraphrasing here, there's existing language on how it can look into waste, fraud, and abuse, or behavior that the department behavior in the department that threatens public safety or demonstrates negligence, incompetence, or malfeasance. And so there are provisions there to broaden the authority of the Office of Inspector General to look into concerns similar to what we've seen here. And that, hopefully will at least cause the department to have pause about concerns that may be brought up, whether by whistleblowers or others within the department, about practices that are not in adherence with standards of care or clinical guidance, so that they can remedy and resolve those within the department.
Okay, Madam Chair, may I have a follow-up?
Yes, a quick one.
Okay, so the, MDH, of course, it says they just don't want to see this. And they talk about, reasons why, they can't respond to complaints. And I'm sure you've seen that. And then they said, but if we're going to insist that the OIG do this, which I certainly hope we will, they have some recommendations like extending from 7 days to respond to 30 days. And again, my understanding is you're just saying, just let us know if we're likely to investigate. And that might even say, we don't know yet, but in 7 days, let me know that we've heard you. And we're trying to see if we have the authority. Is that right? So what's your response to MDH?
Yeah, really the 7 days is just to acknowledge a response and whether you're knocking on the right door or not, right? We're not asking them to conclude an investigation. We're not asking them to do a thorough evaluation. This is just are you coming forward with your complaint and we're the proper recipient of this, or that you should go to the EEOC office, or that you should go to the Audits and Compliance office, that it's just an acknowledgement and indication whether the complainant has reached out to the right office. Obviously, if they need more time to do a thorough investigation, they have full time to do that. It's just 7 days to at least respond and let the complainant know that you are barking up the right tree or you're not.
Okay.
An acknowledgement.
Thank you. Delegate
Bagnall.
Thank you, Madam Chair, and thank you for this bill. I think a lot of us had concerns about, you know, the best approach for dealing with these issues as they arose. Do you? I think this question is actually for Senator Lamb, because we know that public health risks can exist outside of just the Department of Health, but within other state agencies. Do you see this as a potential framework for other concerns? If there are whistleblowers who have identified a concern to public health, that this might be a template by which we could expand those protections?
It could be. I think most of the public health programs are housed within MDH. So I think this was where we wanted to start. This is where Dr. Ray had first brought up her concerns. You know, I think it does open up a question, which I know is under the purview of the Health and Government Operations Committee, when there are concerns that expand beyond waste, fraud, and abuse within the department. Where are the proper avenues to pursue those? Whether that's within the Inspector General, if the department has that, or if they have a equivalent type office, or if there needs to be greater provisions to ensure an avenue where a complainant can bring those concerns forward. I think for MDH, this is a good first step. They are the ones that have probably the most of any agency's clinical kind of type programs. And so this is really to help focus on some of that, where I think we've identified a real gap here beyond waste, fraud, and abuse. When concerns are brought up, where do they go? Especially at MDH.
Thank you.
Okay. Delegate Chisholm.
Thank you, Madam Chair. And I might be way off base here, but I remember working with Delegate Barron on this type of issue. I think it was last year when we passed a law to make the Office of the Inspector General in the Maryland Department of Health into an independent unit of the state, which was to become the Maryland Office of Inspector General for Health, which I believe comes July 1st of 2022. So my question is for Senator Lamb. Being that it's transforming into that new independent unit, if that independent unit would have been set up last year, do you think this situation would have been avoided? And I'm asking that because I'd like to know, do you think that this bill that you bring would have changed anything if this independent unit would have already been established this time last year?
I wish it would have, but I suspect no, that it wouldn't have changed anything. I think the bill that Senator Hedelman sponsored and brought forward last year that was passed will bring the Office of Inspector General outside of the department and formally create it as more of an independent office. However, I think the response that Dr. Ray would have received from the office would have been the same, that it was outside the purview of the office, because I don't think it changed the purview that and the charge and the mission that the Office of Inspector General has when it comes to investigating concerns within MDH, which are limited to waste, fraud, and abuse. And so when these clinical concerns arise, they said, and they've conveyed that to Dr. Ray, that this is outside their purview.
Thank you, Senator. Thank you, Madam Chair.
Thank you, Delegate. And the last question goes to Delegate Lewis.
Thank you, Madam Chair. Thank you, Senator Lamb, for bringing this important bill. My question is for Dr. Ray, and I am incredibly impressed with your courage and really respect your commitment to public service. And I'm just wondering if there are other employees in the Maryland Department of Health who might now be prepared to reveal waste, fraud, or abuse, to come forward and are afraid to do so. And if there are, would this bill help them to come forward?
Thank you. I am certainly hoping that that's one of the main effects of the measures that we're taking with this bill. I know the clinicians I work with that would like to report do feel morally obligated to do so. for the most part, they don't feel safe to do that. People have lost their jobs as a strategy for preventing those types of things from being exposed. So unfortunately, the fear that they have of reporting is valid. And I wish I could encourage them. When I went to different offices, I was trying to find somebody that I could provide to them as well. And I think initially, I thought within the first month or two, there were folks who felt the same as me that wanted to join, but I couldn't find an active person to take that on so I could refer them to a safe advocate. There was no advocate. So they watched me strike out at every office I went to, and that only further encouraged them not to report and to protect their jobs, which I think in their view was a way of protecting their families and their income. So I understand, but I do hope that that's the effect of this bill. There's probably other measures that need to be taken as well, but it's a great start.
Okay.
Thank you. Thank you, Madam Chair.
Thank you. Seeing no further questions, that concludes the hearing on Senate Bill 708. Thank you, Senator. Thank you, Dr. Ray. And we will go to Senate Bill 636, Senator Zucker, Maryland Department of Health waiver programs, wait list and registry reduction. This is the End the Wait Act, which we have heard here on the House. And so we have just Senator Zucker speaking to us today on behalf of this bill. Senator, welcome to HGO.
Oh, it's great to be with you virtually. Senator Craig Zucker here in support of Senate Bill 636. Just wanted to really thank Delegate Jocelyn Pena-Melnick, who's the House sponsor of House Bill 1403. Also wanted to just say hello quickly to my teammate, Delegate Ann Kaiser. You've already heard this bill. It passed unanimously out of the Maryland State Senate. The only change since the hearing is both the Budget and Taxation Committee and the House Appropriations Committee committed $40 million to make sure that this bill takes effect. And with that, I'd be happy to answer any questions. And of course, I would urge a favorable report both on this bill and Delegate Pena-Melnick's.
Thank you, Senator. Are there questions for the Senator? Okay, seeing none. Well, thank you for your excellent testimony, Senator. That concludes the hearing on Senate Bill 636. And we will go now to Senate Bill 917. The cross-file on 917 is House Bill 510. This is Senator Augustine. And it's Healthcare Facilities, Health Services Cost Review Commission User-Free Assessment. Is Senator Augustine here?
Yes, I am, Chair Collison.
Oh, good. I'm glad because I heard you were a little under the weather.
I am, but you all are virtual.
That's right.
So I'm here.
Glad you could be here. Thank you,
Chair Collison. Senator Malcolm Augustine here, asking for support for Senate Bill 917, which is identical to House Bill 510, sponsored by Chair Pendergrass, which is passed second reader in the Senate. The bill alters the methodology for determining the user fees the Health Service Cost Review Commission may assess on hospitals and related institutions to fund its operations. I request a favorable report.
Thank you, Senator. Are there any questions for the Senator? Okay, seeing none, thank you for coming over virtually. Senator, that concludes the hearing on Senate Bill 917. We will go to Senate Bill 978. This is Senator Edwards, Garrett County Memorial Hospital, lease authorization and alterations to the Board of Governors. And this is a cross-file of House Bill 1471. Senator Edwards, welcome to HGO.
Thank you, Madam Chair. As you said, Senate Bill 978 is emergency bill. It's cross-file with 1471. As far as I know, they're in the same position. The bill drafter, when he was done, found out he had to add something, so he did an amendment we put on over here, and I believe Delegate Bites will put it on over there. So it's my understanding we're in same on the same song sheet here. What it does allow the Garrett County Memorial Hospital, which is better known now as the Garrett Regional Medical Center, to do leases. Restructures the board and says what they can do in the lease. They've been working, they have a working agreement with the University of West Virginia Hospital System. This will allow them to work on a lease with what's called the West Virginia United Health Systems, Inc., which is an offshoot of the West Virginia University system. And we have a great hospital. Regional Medical Center is ranked in the top 20 in the whole United States in rural hospitals. So they're doing a tremendous job. This will allow them to actually expand upon that, because tying in with West Virginia University, they can send specialists over. It's not that far away, and vice versa. And they'll share all kinds of equipment, et cetera, with each other. So I would ask for your support of Senate Bill 978, which is very important to Garrett County.
Thank you very much, Senator.
Bill. Yeah.
And I do see a question from Delegate Rosenberg.
My question is more a point of personal privilege, and that is to ask the senator if this is the last bill hearing he will have in the House, and to ask him if he remembers, I may have been there, but I don't remember, your first bill hearing in the House in 1983 when we were freshmen together on the Appropriations Committee.
Delegate, I can't remember what I did last week sometime, 1983. I don't remember the first bill, but I do have another bill coming to the House, which
Good for you.
On tomorrow. And I think I have maybe one more, and that's probably it.
Good for you.
Madam Chair, in case you don't know, Delegate Rosenberg and I are the two oldest legislators, not age-wise, but longevity in the legislature. We came in together, and I think we're the only two left from that class of 1983 when we first started. All got elected in 82.
I prefer to think of it as seasoned, Senator.
Thank you. That sounds better.
Most seasoned legislators.
I second that motion. Yes,
I agree with that. Sounds a lot better. Thank you very much.
Thank you.
Have a good day.
You too. And that concludes the hearing on Senate Bill 978. Senator Beidel is not here, so I'd like.
I'm here.
Oh, wait a minute. Okay. Sorry, Senator Beidel. Then forget what I just said. We are ready to start Senate Bill 696. This is Senator Beidel. Maryland Loan Assistance Repayment for Nurses and Nursing Workers Program Establishment and Funding. This is a sponsor-only hearing. So, Senator Beidel, welcome to HGO.
Thank you, Madam Chair Cullison and members of the committee. Thank you for the opportunity to present 696, which is a cross-file of House Bill 783. And our bill was, that the Senate bill was considered by both EHE and Budget and Tax, and it passed the Senate 46-0. I understand that there's some amendments that your delegate, your chair, your member, Delegate Kelly, would like to put on the bill. And she has shared those amendments with me, and I certainly will agree to them so that both bills will be in the same posture. I would love a favorable report with the House amendments.
Thank you, Senator. Are there questions for Senator Beidel? Seeing none, that concludes the hearing on Senate Bill 696. Senator Beidel, stay where you are because we're going to Senate Bill 711. This is Health Occupations, Licensed Athletic Trainers, Dry Needling Approval. And we have this is a sponsor-only panel. Senator, it's all yours.
Thank you again, Madam Chair and members of the committee for hearing Senate Bill 711. You did hear the House version of this bill, but to my knowledge, it's not been to your subcommittee and it's not had a vote. This did pass the Senate, the full Senate, from 45-1 on March 18th. I've given you written testimony, as have a number of the advocates, and I ask that you review that, but I want to go through a few of the points that I pulled out of the written testimony today. First off, the amendments on Senate Bill 711 successfully address the Maryland Board of Physicians' concerns. And so they have now written that of course, they don't take a position that they support the bill, but they no longer oppose the bill because the Senate accepted their amendments. Athletic trainers, this is about dry needling. So dry needling is a process by which a long, thin, like filament needle is injected into the muscle, and it typically gives immediate relief. Athletic trainers are authorized to do this in 26 other states and the District of Columbia. So we would be the 27th state, the 28th jurisdiction. You know, I understand a little bit about turf wars, although I haven't served on your committee and I've only been in finance for the last 3 years, but it's my understanding that you went through a similar battle with the physical therapist and dry needling a few years ago. And physical therapists are now doing dry needling. The Senate athletic trainer, the senior athletic trainer for the University of Maryland, makes some really good points in his testimony. He was trained in Michigan, took the position in Maryland, but can no longer perform dry needling for the University of Maryland athletes. He told us in a testimony to our committee that it really is difficult for these young players that are, of course, have class schedules, practice schedules, or playing games, sometimes out of state. And it's very difficult for them to leave the facilities at University of Maryland and go somewhere to have the dry needling done. So it would be very, very helpful for particularly our colleges, our Naval Academy, our universities, our professional stadiums or professional teams to have dry needling. What happens is the little filament needle that goes in actually is a deactivation of the trigger points, and it brings immediate relief. My husband had gone through physical therapy for weeks for a torn hamstring, and it was not until he had dry needling that he got that immediate relief. We were talking about that the other night. So it really is very, very helpful for our athletes. The training required in the bill is the same 80 hours that other professionals receive. So acupuncturists, physical therapists, and chiropractors all receive the same training, and that's what would be required in the bill for the athletic trainers. 70% of our athletic trainers today have a master's degree, and now going forward is going to be a requirement that all athletic trainers receive a master's degree. So they will have the proper training before they even attempt to be trained in dry needling. You do have letters of support from physicians, particularly there's an orthopedic surgeon that writes a very good letter. Comar defines acupuncture as a form of healthcare based on a theory of energetic physiological that describes the interrelationship of the body, organs, or functions of a human or animal with an associated point or combination of points. Dry needling is not that kind of comprehensive treatment. Maryland recognizes dry needling and acupuncture are very different skills. This will only apply for athletic trainers to treat their athletes. It's not for general practice. Like I said, 70% of our athletic trainers already have their master's degree. Many of our athletic trainers that are here today in Maryland have practiced in other states. Not that they would be grandfathered, but they have practiced in other states. And the supervising physician must agree to let the athletic trainers complete the specialized skill. Colin Francis, the athletic trainer for the Ravens, previously the head trainer at Indiana University, in his written testimony discusses the importance of providing dry needling to athletes. I want to thank Colin for bringing this important change in scope of practice to the legislature for our consideration. It's an important change, and I ask for your favorable support. Thank you, Madam Chair.
Oh, thank you, Senator. Questions from the committee. I'll begin with Delegate Lewis-Young.
Thank you, Senator Beidel, for bringing this bill across the street. If I understand correctly, right now, the only opposition is from the acupuncturists, and the letters from them all sounded very similar. Could you tell me if any of that opposition raised any training or safety concerns that are not addressed in the bill?
Thank you very much, Delegate Young. This, in your testimony today, now that it's come across from the Senate, you only have one letter from the Acupuncturist Association. So you don't have all those letters that we had previously. I don't know if that means that you're now in support, but there was a study that was sent to you and was also, I think, attached to my testimony, discussing how minor any of these, there's always going to be adverse reactions to any procedure that we do, but it's very, very minor. And in fact, physical therapists have had fewer adverse reactions in their training than acupuncturists have had. And now the athletic trainers would have the same exact training as the physical therapist had a few years ago. So the studies have been very good.
Thank you.
Thank you, Delegate. Delegate Hill.
Hi, Senator Beidel. Thank you very much. I haven't had a chance to look at the Senate amendments, but I was intrigued by your statement that this is a turf battle issue. And my understanding is that the issues that were raised wasn't so much about the 80 hours, but the underlying background and training on which those 80 hours were applied, right? So 80 hours for me to learn how to fly a plane is very different if I don't have any background in mechanics of airplanes and that kind of stuff, right? So what I'd like to know is what is going to address the issues about inadequate background training, because the 80 hours is about dry needling as a technique. Is that correct?
That's correct.
So what about the absent physiological background issues? Certainly athletic trainers know an awful lot about bodies, but it's a different understanding. So how is that being addressed?
Well, the athletic trainers would really disagree with that. They feel like they're, particularly these master level, they've reached their master's degree, that they do have the proper training to then, the proper underlying training then to do dry needling. You'll see in your testimony today, there is a good deal of support from doctors, and our own doctor in the Senate, Dr. Hill, our own doctor, Dr. Lamb, did support the bill both in committee and on the floor. So I think, he particularly was very comfortable with the training that the physical therapists come to dry needling with.
All right, thank you for that answer. But we'll take a good look. Thank you.
Yeah, I appreciate it.
Thank you, Senator. Seeing no further questions, that concludes the hearing on Senate Bill 711.
Thank you.
And thank you. And we move to Senate Bill 77. This is Senator West. Health Occupation Boards, Investigations, Right to Counsel. This bill does not have a cross-file, so we'll hear from the senator and a panelist. So Senator West, welcome back to HGO.
Well, it's such a pleasure to be here. Good to talk to you, Madam Acting Chair. I guess that's the way to describe you. Although I see the actual chair is looking in. So this bill, Senate Bill 77, passed the Senate unanimously. When I was in 1973, I was a summer law clerk at my law firm, and another clerk that summer was a lady named Natalie McSherry. Well, Natalie moved on, and now she's the president of the State Bar Association, but she approached me last summer with this bill, and I was happy to take it for her. She spends a lot of her time representing clients who are subject to disciplinary proceedings. They're healthcare workers, licensed healthcare workers, but somehow charges are being suggested against them. And the disciplinary process for a license or certificate holder in healthcare has the potential to limit or end someone's right to practice and disparaging their reputation along the way. Some of the investigators for health occupation boards can have a rather aggressive style of interviewing, especially if they have limited healthcare experience. So what this bill provides is that in the context of those disciplinary proceedings, a licensed healthcare worker has the right to have legal counsel present to represent the worker during the investigative proceedings. As I say, it was passed unanimously in the Senate that we run into some opposition from the Board of Physicians, which suggested that lawyers, if lawyers were present, they could engage in the kind of conduct which would disrupt the proceeding. And frankly, in my experience, having practiced law for nearly 50 years now, the lawyers that engage in that kind of contact mostly are seen on television. They're not there in real life. But nonetheless, we amended the bill to try to deal with the objections of the Board of Physicians. So now we are limiting what counsel can do to asking the licensee questions, to ask that a question be clarified, to provide advice to the licensee, and to provide information relevant to the investigation on behalf of the licensee. So that's it. And we also added a provision, which is in your amended copy of the bill, which says that if the board concludes that the lawyer is substantially interfering with the investigation of the interview or violating the rules of professional conduct or acting in a manner that's prejudicial to the administration of justice, the lawyer can be removed. So with those two amendments, I think it's only appropriate that someone who's in danger of losing his or her license to practice medicine should be entitled to be represented by counsel and extended all the benefits of due process. And as I say, we passed the bill unanimously in the Senate, so I would urge a favorable report in HGO.
Thank you, Senator. So we're now going to hear from Richard Block.
Thank you, Madam Chair. I think Senator West has said very well the reasons why this bill is so important. I've been representing the medical field and the mental health field especially for 50 years. And in these investigations, there are various issues that can arise during the interview of the licensee that cause confusion or the like. And the prior position of the Attorney General that this is a civil proceeding and you're not entitled to counsel, I think prohibits someone whose license could be revoked and ability to practice limited or lost should have the right to counsel. Most of the boards I deal with allow them to be present. Sometimes they allow them not to say one word, so you're sitting there sort of holding your client's hand. And this bill with the amendments provides very important opportunity for a licensee to be protected during a process that is very critical to their practice. So I would urge a favorable report. Thank you for the opportunity to address you.
Thank you, Mr. Block. Are there questions from the committee? Delegate Hill.
Thank you, Senator Russ. I think this is a good bill. And I'm actually surprised that that's not already a standard. I do have a question. I understand you had to put the amendments on to, calm down opposition, but I'm curious where it says they can exclude, the board can exclude the attorney if they determine that they're substantially interfering, violating the rules of professional conduct or acting in a manner that is prejudicial to the administration of justice. I'm just curious about why you don't think giving the board that authority without them even having to document or explain specifically what actions would have them make that determination, and without them having to give the licensee the opportunity to get substitute counsel before the proceedings continue?
Yes, thank you for the question. I guess the answer is that neither Ms. McSherry nor I feel that this is really a problem. We added this language to the bill in order to suggest to the Board of Physicians that if it should ever happen, there's a way to deal with it. But in my experience, lawyers in Maryland act responsibly. Specifically, the amendment talks about violating the rules of professional conduct. Lawyers don't want to do that, and they don't want to be hauled before the Bar Council and subject to discipline imposed by the Maryland Court of Appeals. So I just don't think it's going to happen. If it should turn out to happen and be a problem, we can go back and tweak this language later on. But I don't think we need to do this at this point.
Madam Chair, may I interrupt the meeting, please?
Yes, Madam Chairman.
Thank you. I need the Health Subcommittee to leave this meeting to attend a Zoom subcommittee meeting. So would all members of the Health Subcommittee,
Public Health
Subcommittee, please sign out and log into that meeting that's going on at this time. Thank you, Madam Chair.
Thank you, Madam Chairman. I have a question for Senator West, and I just want to affirm that if the individual chose to have counsel, that the individual is responsible for compensating that counsel.
Oh, absolutely.
Hiring them.
Yes, absolutely. No question about that. The bill does not change that the practice in any way.
And right now, as I'm understanding it, they are prohibited from having any counsel present.
I don't believe there's an actual statute that prohibits it, but the boards that have the investigative staff that has the right to control the investigative chambers frequently excludes counsel. So this would provide an affirmative conferral of a right to have counsel accompany the medical professional into the chamber where the professional is going to be examined.
Okay. Thank you, Senator. Are there any other questions for Senator West? If not, that concludes the hearing on Senate Bill 77, and we will go to Senate Bill 9, also Senator West, and this is Procurement Minority Business Enterprises Study. This is not a cross-file, as I understand it, but only the Senator is meeting with us today. So, Senator West, it's all yours.
Thank you very much, Madam Acting Chair. Senate Bill 9, like the last bill, this bill was passed unanimously by the state Senate. Several years ago, after the situation in Minneapolis, the Senate formed a work group to study equity and diversity in Maryland. I was asked to be a member and participated in the various hearings. At the end of the work group's work, I was asked to take two bills or take two recommendations and turn them into bills. This is one of the two. We took a look at minority business enterprises in Maryland. And in order to become qualified as an MBE, you have to jump through a lot of hoops. There are separate requirements to become an MBE where they have a different designation for it at the federal level. And our question was, why in the world would someone have to jump through all the hoops at the federal level and then come right back and jump through many of the same hoops all over again in Maryland in order to be able to become qualified as a Maryland minority business enterprise? So the bill I originally introduced said once you have become qualified to become a federal MBE, you should automatically be able to waive in Maryland in order to become a Maryland MBE. The Budget and Tax Committee, in its wisdom, decided to change this bill into a study instead of directly taking that action. This bill requires the certification agency designated by the Board of Public Works to study and render a report making recommendations for streamlining the process for certification of MBEs and requiring entities to provide information to the certification agency regarding the procurement of minority business enterprises. So my bill as originally drafted was going to go right to the end result. This bill instead suggests a study to occur over the course of the summer with recommendations to be prepared by the end of the year so that next year a bill can be drafted to embody the recommendations of the study group. As I say, the bill passed unanimously in the Senate. I don't believe there were any objections to the bill, any opponents, and therefore I would hope for a favorable report from HGO. Thank you.
Thank you, Senator. Are there any questions for Senator West on this bill? Give you 10 seconds. Okay, seeing none. Guess you did a great job, Senator. Thank you so much for visiting us.
So good to see everybody again. Take care.
Good to see you. And that concludes the hearing on Senate Bill 9. We will go to Senate Bill 487. This is Senator Griffith, and it is Procurement Minority Business Enterprises Revisions. And I see Mr. Bailey from Senator Griffith's office. Is the senator here, or are you presenting for her?
Senator Griffith asked me to present for her as she is currently in committee.
Excellent. And this is a cross-file of House Bill 389. So go ahead, Mr. Bailey, it's all yours.
Okay. Good afternoon, Madam Chair and members of the Health and Government Operations Committee. I'm Najee Bailey, legislative aide to Senator Melanie Griffith, and I'm pleased to present Senate Bill 487 on behalf of Senator Griffith. Senate Bill 487 is cross-filed to House Bill 389, which passed in this committee with amendments unanimously. 487 also unanimously passed in the Senate with the same posture. This bill will implement the statutory recommendations of the Department of Legislative Services evaluation of the Minority Business Enterprise Program, establish the position of the Minority Business Enterprises Ombudsman within the Governor's Office of Small, Minority, and Women Business Affairs, expand accountability and transparency requirements for the program, codify an existing set-aside program for small businesses, and applies prompt payment to subcontractor requirements to all subcontractors. Thank you for the opportunity to present Senate Bill 487 and respectfully request a favorable report.
Thank you very much, Mr. Bailey, for pinch hitting there. Are there questions on House Bill 487? Seeing none, that concludes the hearing on Senate Bill 487, and we will go to Senate Bill 644. This is Senator Salling, and the Department of General Services study on procurement preferences for businesses in historically underutilized business zones. This is not a cross file, so it will be the senator and his panelist. We'll begin with Senator Salling. Welcome to HGO.
Thank you so much, Ms. Chair and Vice Chair and Committee. It's an honor to be in your committee today. For the record, I'm Senator John Ray Salling, and I'm here today to ask your support on this bill for a study on underutilized hub zones. The goal of the study is to craft a bill that will provide an opportunity for small businesses to thrive in this economy climate through implementing a hub zone. In a hub zone, government departments would work to achieve a certain percentage of contracts for businesses that are in these zones to help underprivileged businesses in our state. I think it would be a great opportunity to help our businesses, our constituents, and the state as we continue to recover from this pandemic. I respectfully ask for your favorable report on this review and this bill. And I would like to introduce Mr. Wayne Frazier, who would do a better job than me and can really explain this even better. As a good friend, and I know when he's done, if you have any questions, I'm sure he can answer them also. So thank you, Madam Chair, and I thank you for this opportunity and your favorable report.
Thank you, Senator. So we will hear from Mr. Frazier.
Yes, good afternoon. Can you hear me?
Yes, we can. Thank you.
Very good, very good. Good afternoon. My name is Wayne Frazier, and I'm president of the Maryland, Washington Minority Companies Association. We're headquartered in Baltimore. However, we cover the entire state. We have a membership of roughly 250 strong women and minority-owned businesses who are primarily in the trade, construction, building trades field. The opportunity that the introduction of the U.S. hub zones certified businesses bring to Maryland is one of an enabling opportunity to take advantage of the millions of dollars that will be coming down from the various infrastructure projects that will flow down to the state through Department of Transportation, through DGS, and so forth. Currently, there are 400 plus hub zone certified businesses in the state of Maryland, of which 80% are located in Baltimore City and Prince George's County. The other 20% are located far west in Garrett County and on the Eastern Shore in Dorchester and the lower Eastern Shore counties. And the significance about hub zone certified businesses is that they must hire 35% of their employees. Their employment must come from those designated areas. So that means those impoverished areas where those businesses are located have to hire from those communities in order to be certified. And then they get recertified on an annual basis. So that ensures that there is no funny play at all. And it helps those who live in those areas to have employment and care for their families. This is an enabling opportunity that, and again, it is race neutral. And that's what makes it so good, is that everyone can share who live in those impoverished areas. It will help uplift them. I will take any questions that you may have.
Thank you, Mr. Frazier. Are there questions for Mr. Frazier or the senator on Senate Bill 644? Looks like we have the information we need. Thank you very much, both of you, for being here today and your testimony. And that concludes the hearing on Senate Bill 644. Thank you. And we will go to Senate Bill 542. Senator Kagan, Senate Finance and Procurement Grants, prompt payment requirement. And this is a cross file of House Bill 452. Senator Kagan.
451, Madam Chair, I think. Nope.
I have 452 on my list.
Okay.
But
all right. Senate Bill 542 and House Bill 45. Anyway, it's all good. It's the wonderful Dana Stein. Good afternoon, colleagues. Cheryl Kagan, very proud to be the senator for Gaithersburg and Rockville, bringing an important bill for the nonprofit sector. So I think you all probably are aware of the prompt payment laws that govern our small businesses to make sure that when a business performs a service or offers goods, that the state has to pay them back within 30 days. And after 45 days, they have to make an interest payment to sort of make those small businesses whole. We don't do the same thing for our nonprofits, and they tend to be running on a shoestring. They can at least afford it. The problem, an additional problem, is they're not only waiting for the money, but a lot of times they have to pay it forward. They have to front fund the rent the room, hire the staff, create the brochures. And so they are literally out the money and yet still have to pay their staff, pay their rent, and all that. So this is creating payment parity, as I call it, to make sure that our nonprofits are treated at least as well as our businesses, both of which we have to be supporting. I think you all are aware of the role that nonprofits play in our economy. About 13% of our workforce is in the nonprofit sector, and the burdens on them, especially through COVID, whether it's greater need for food or housing, whether it's more need for mental health care and others, there has been a disproportionate burden. This comes as a recommendation from the Mega Council that we created several years ago, the Maryland Efficiency in Grants Applications, which is kind of creating a common app so that nonprofit leaders can spend more time working on their mission and not filling out paperwork with applications and reports. So this is a unanimous Mega Council recommendation that Delegate Stein and I have sponsored. There are 34 Senate co-sponsors, and we are not much doing that this year. I'll spend a little bit of time talking about the amendments. So the fiscal vote as it came in was higher than we expected. Frankly, these folks should be able to pay their bills, but there were a number of departments and agencies that are really not part of the problem. And so we exempted the state higher education folks, the Department of Transportation, TEDCO, Labor, Commerce, DNR, MDEM, the Maryland Department of Emergency Management, the Energy Administration, the state judiciary. They either do their processes differently like the judiciary does, or they're not part of the problem. And so that is, so we've exempted those folks, and we really want to focus on those that are the problems, that are delayed. I wanted to flag that there is a revised fiscal note, and suddenly there are two departments that suddenly started whining. The Maryland Department of Health, bless their hearts, they've been busy. They said that they're going to need to hire 10 more people just to pay their nonprofits back in time. I think that's insane and inappropriate. It's disrespectful. It makes the fiscal note look completely irresponsible. And so, we really, MDH was one of the sources of information in the original fiscal note, and they didn't say anything. They have a seat on the Mega Council. They didn't say anything, and it shouldn't take this bill to get them to pay their nonprofits on time. We heard Today, we had a call with GoCap, and they are also a member of the Mega Council. They've had a seat. We sent everyone on the Mega Council, the Maryland Efficiency and Grants applications. Every one of them saw a copy of the bill before we dropped it, and they didn't say anything. And GoCap, which is one of the worst offenders, has now started sort of intimating that they prefer to be exempted. I'm going to ask you for your consideration not to exempt any agencies or departments that are not already exempted by the Senate's amendments, because those that were not included are part of the problem, and our nonprofits must have payment parity so they can continue to do their important work for the residents of Maryland. I thank you for your consideration, and I am out of time.
Good timing, Senator. Questions for Senator Kagan. Delegate Krebs.
Thank you, Senator Kagan. And obviously this is a good bill because we all voted for it in our committee, but it still bothers me about why these agencies need so many more positions just for a timing issue. They're going to process these things one way or another. And I don't know if it's COVID related and people working remotely related, but it'd be somehow nice to have some kind of accountability if they're going to demand these more positions. But my one question specifically has to do with MDH, and some of this is behavioral health. Would this affect the Optum payments, the payments for behavioral health and mental health providers that someone does for us? How would that work?
So what I can tell you is that MDH, thank you, Delegate Krebs, and thank you for all that you do. And I'm a little bit sad that you're leaving the House. I wish you the best. A February 2022 report had MDH as the worst offender, the highest percentage of late payments among state agencies, with a total of $63.5 million that was paid late. So in terms of why do they need 10 people, you got me, and why they didn't talk about that, complain about that at a Mega Council meeting when this bill was recommended unanimously, why they didn't talk to the fiscal note writer when they were a primary source of information. I find it perplexing and disappointing. I think that MDH and the rest of the departments that are not exempted should be paying our nonprofits so they can continue to do their important
work. I don't disagree, but do you know if all those claims you just mentioned, we're drilling down on, if they were payments that were done by Optum, does that include the Optum problems that we've been having?
I don't know that I know that, Delegate.
I think our committee should try to figure that out. Thank you so much.
Right.
Thank you.
Thank you, Delegate. Any other questions for the Senator on this bill? Seeing none, that concludes the hearing on 542. And this is Senator Kagan again, and we're going to Senate Bill 373. And oh, by the way, Senator, yes, it was, the House bill is 51, not 52. My bad.
All good.
So Senate Bill 373 is Department of Transportation, Notice of Entry onto Private Property. And that is a cross-file with House Bill 163, I hope. Senator Kagan.
Thank you, Madam Chair. For the record, again, Cheryl Kagan, Senator for District 17, Gaithersburg-Rockville. This is a cross-file with the good Delegate Carr, who is in the room. The Senate bill simplified. So we liked the idea of Delegate Carr wanting, and the House, wanting more accountability when the Department of Transportation goes onto people's properties where they're considering eminent domain, where they are working on a project. We just thought, rather than the whole question of public lists and private lists and redaction and all that, we would just simplify it and say, if MDOT, if the Maryland Department of Transportation has a project in our district, that we ought to know about it. We've passed other legislation like this, and we just pared this down and said, notify the legislators so that we know what's going on in our district and can take action and defend or advocate or whatever the appropriate case may be. The bill passed the Senate committee and the floor unanimously as amended. Happy to take any questions, but I think it's pretty simple.
And Delegate Carr, I'll go to you first since this is your cross-file, but it's not exactly the same at this point.
Right.
Thank you, Madam Chair. And thank you, Senator, for all your work on this bill. I really like what the Senate did with this bill. And I know that as it came across, it had language in there about sociological information. And is it fair to say that that aspect of the bill was sort of maybe the most problematic and maybe made the bill seem more complex than perhaps it was. Is that fair to say?
That is totally fair to say. That phrase perplexed us all. So that is now gone.
So let me ask you, Delegate, you are comfortable with the Senate amendments?
I like what the Senate did to this bill.
Okay. All right. Thank you. Are there any other questions for the Senator on House Bill 373? I mean, Senate Bill 373. Okay, great. That concludes the hearing on Senate Bill 373. Senator Kagan, you've got one more, and that's Senate Bill 633, Public Safety 911 Emergency Telephone System Alterations. And this is a cross-file with House Bill 1105.
Yes.
Senator Kagan?
Since I was concise on the last bill, Madam Chair, I'm hoping that if I run a little long on this one, but this is a really important bill. So Cheryl Kagan, and I'm introducing myself here as chair of the Next Generation 911 Commission. You all got copies of a 98-page annual report delivered to your offices in December. This was the fourth and final report, and Maryland is at the forefront of updating nationally, of updating our 911 systems, whether that's been about funding, staffing, cybersecurity, oversight, accountability, training. There's so much that thanks to the leadership of this committee and the General Assembly that we've been able to accomplish. This is our fourth and final omnibus that has been endorsed by the commission. And before I do a deep dive, I have to give an enormous shout out to Delegate Sue Krebs, who served all 4 years as one of our members. Also Senator Riley, Delegate Hill, who jumped in after Delegate, now Senator Jackson, the birthday boy, came over to the Senate. And so we had wonderful legislative partners also on this commission. Were 911 center directors, the disabilities community, telecommunications folks, cybersecurity experts, finance folks. Just to give you an idea, we really had the right people in the room, and we came up with thoughtful recommendations. These were distilled into ultimately 6 bills that we've brought this year. And this is kind of the big, again, the omnibus. It's got 9 components, and I know you heard, and I think Delegate Hill did a fantastic job presenting it, but I know there's some questions and concerns, so I'm gonna run through it super briefly. So first, and most of them are gonna be fast, cybersecurity, we wanna make sure that every one of the 24 911 centers are keeping up with cyber advances, and there are consequences if they don't. The comptroller reporting, there are some telecommunications companies that have not been remitting appropriately. So we have extended the number of audits so that we've got oversight to make sure that the telecoms are collecting the right amount of money and then distributing it, giving it to the 911 board to then give to the 24 jurisdictions. We also are making sure that the 911 board, which is the oversight and collects all the state portion of our 911 fee. There is no vice chair. We also were shifting and making the body select the chair, as most of our chairs do. Reclassifying our 911 specialist, Delegate Kipke had a bill on this. These are our first responders, our courageous women and men under the headset. They have a ferocious job, and this would reclassify them in the same way that 9 other states have done. Implicit bias training was required in last year's bill, and we are going to make sure that at least once every 4 years that our 911 specialists get training on that, and that would be provided by the 911 board. Occupational wellness, making sure that, again, our 911 specialists don't have to get permission from their supervisor or do anything public. They can go straight to a mental health specialist and make sure that that is kept confidential to keep them well. Suicidal ideation is an enormous challenge. And in Harford County, we had a 911 specialist die by suicide. And so we must take care of our 911 specialists better. Similarly, we must make sure that they are not being paid minimum wage. We leave it to the counties to decide what to pay them, but they should be compensated benefits, wages, and more in a way that is reflects their service. 911 board, operations, we talk about filling vacancies. And then the last of the 9 is allowing our 24 jurisdictions to set the local portion of the fee. And this is where I might go a little bit long, Madam Chair. For many, many, many years, the $1 fee, 25 cents went to the state, 75 cents went to the counties. When we passed the Carl Hanna Act in memory of my constituent and friend who died when 911 failed after he was struck by lightning, we took the 25-cent portion of the fee and made that 50 cents. The 75 cent was unchanged. We closed the loophole so that everyone for every phone was paying that fee. That we also ended up having the state pay for a lot more of 911 costs. But the last thing we did in 2017 was allow the locals to increase the local portion of their fee. 6 counties have already needed to do that because they're not getting enough revenue in. And this would allow the locals to do that, to increase the local portion of the fee. They cannot spend it on anything other than 911. There are annual audits. And it means that they won't have to take money from their general fund where that should be spent on school, roads, healthcare, or anything else to pay for 911. I am happy to take questions, particularly on that one. I want to be really clear as to the importance of that. So with that, I will stop and thank you for your attention on this really important bill.
Thank you, Senator. So questions from the committee? Any questions?
Question. Come on, guys.
Well, I have a question. And that is, so what is the feedback from MACO on the authority to raise the fees that way?
Thank you so much, Chair Collison. MACO has been a remarkable ally and partner throughout our work for 4 years, and they strongly stand with the omnibus bill. They believe in local authority. And so there are many jurisdictions that will have no need to ever revisit the local portion of their fee. But there are numbers. So for instance, in Garrett County, they are covering 14.02% of the costs of their 911 center with their elevated fee. And Garrett County already raised it an extra 75 cents, which is the max according to the Carl Hanna bill. And they are still not getting it. So Worcester County, they went from 16.26% to 32.53%. They are still woefully short. There is Caroline County. They also increased the 75 cents and they are still below 50%. So that means they are taking money out of their general funds. When people feel like they're paying a 911 fee, they assume it is paying for and covering the costs of 911. And that is not proving to be the case in any of our jurisdictions. And so I trust our locally elected officials to make good choices, to be accountable to the voters. They're not going to raise it 20 bucks. I mean, they would be bounced out of office. But if they want to raise another 25 or 50 cents, they shouldn't have to run back to the General Assembly for permission, and they shouldn't shortchange their local needs.
Thank you, Senator. I'm going to take 2 questions. We'll start with Delegate Carr.
Thank you, Madam Chair. So just one quick question is, so under the bill, do local governments, does it have to be like a fixed fee amount, like $1.50, $1.25, $1.75, or do locals also have the option to have it be a percentage? Like say they wanted to do it like 2% or 2.1% of the total bill.
Interesting. That's never the way we've done it, and that's not what this bill proposes to do. So again, for, I think it was 17 years or something, we had $1. So if you had a landline, you were paying $1. If you had a cell phone, you were paying $1. And then if you got a family plan, you were still paying $1. And what happened is people started getting rid of their landlines, which meant that revenues were going down as demand was going up. Because let's say 2 parents and 2 kids all have phones. And so 4 phones are traveling around the state. And so demand for 911 service was going up, and revenues were flat or going down. So by increasing state portion of the fee and letting the locals, if needed, after there was an audit, by letting the locals increase the local portion, we have been able to make some progress, but we are still falling short. And that means we're not paying our 911 specialists enough. They are leaving. It's a lot easier to answer the phone for the sheriff than it is to hear someone shrieking because their baby isn't breathing or their house is on fire. And so we've got to take care of our 911 specialists. We've got to pay them well, and we've got to keep updated on hardware, software, cybersecurity, and more.
Okay, Delegate Krebs, you've got the last bite of the apple there.
Thank you, and thank you for all the great work we've done on this commission. And the bill's got lots of pieces. So on this one particular piece, and Senator Kagan knows I pushed back on this. On the smaller counties that we have, the poorer counties, I understand they have a problem, but we have a very large surplus, we believe, that's going to be in the state portion that we've collected all this extra revenue. And as we put the capital money in and upgraded things, there's going to be a time, we believe, that there's going to be a large amount of revenue left in the state fund. And I would like, and I won't be here to do this, but I would hope that we, instead of just allowing these counties to continue to up the fees, at these small, poor counties, I would like to see us do something in the way of disparity grants or whatever we already do for some of these small counties, because they still have to operate these huge systems. Because I just think it's unfair to keep raising, you know, in my particular, I look at my bill, I went from $1 to $12, and that's a 12 times increase. And I can afford that, but many people can't. And in these smaller counties, I just would like us to do it more and look at the state funding, the state fund piece of this, and say, how can we help those jurisdictions instead of just allowing them to continue to raise their fees on these poor counties? So I have just a philosophical problem with, because our commission was ending their service and we won't be around to maybe advocate for this in the future. I just don't like having an unended ability for local counties to be forced to have to raise their fee, when I think there might be some other solutions for these poor counties. But that's my piece on just on that one little ability to just unlimited be able to raise fees. I wish we had more time. We don't, our commission, to look at it down the road. But thank you so much.
So, so I'm going to hear that as an "isn't that so?" And
yes.
Just to be clear, Carroll County.
I'm sorry, isn't that so? Sorry.
Yes, Carroll County has already increased to the maximum amount. And if Delegate Krebs is paying $12 a month, and I know she's told me this before, that means she has 6 different telephone users in her county. And we can talk about that offline, but that's only because Carroll County has already increased to the max in order to hit their shortfall. To be clear, there is nothing in this bill that would raise anyone's fee a dime, zero, none of it. All it does is authorize the locals the road after an audit, if they are still short and if the locals vote for it, to incrementally. There's some jurisdictions, to be clear, Baltimore City, Wycomico County, they each raised it 25 cents. So not everyone is going to the maximum 75, but we do think that that there should be the local option. The disparity grants and stuff is not something that the commission ever looked at. This is the recommendation that that was strongly endorsed by the 911 Commission. So really hope that you will allow locals that respect and authority. And this is the way it came out of the Senate. There was some pushback on the floor for sure, but we did pass it comfortably and send it to you all.
Delegate Rosenberg.
Thank you, Madam Chair. We say local, it has to be a vote by the local governing authority.
Correct.
Whatever shape that may take.
Commissioners, county council members, county executives, and all that. And they are held accountable, not just in elections accountable, but also checks and balances at the local level. And frankly, because of annual inspections by the 911 board, their local 911 fee revenue and expenditures are audited carefully. And if they are found to be spending a dime on anything that isn't directly 911, I mean, first off, it's forbidden by law, but they would be in very deep trouble and would be precluded from getting any of the state funding for 911 and as a consequence. I mean, we're really clear. And at the federal level, I can tell you that any state or any jurisdiction that spends 911 money on anything else is actually precluded from getting federal next-gen 911 grants. So people are really clear. This is only used for 911 as we upgrade our systems to save lives.
Thank you.
Thank you.
Thank you, Delegate Rosenberg.
Okay, that concludes the hearing on Senate Bill 633. And thank you, Senator Kagan. Just want the committee to know we have 6 bills, and it is now 4 o'clock, and we need to be on the floor at 4:30. So just to the extent that we can be expedient, let's try to do that, and we'll move to Senate Bill 250, Senator Hayes, State Procurement Payment Practices. Welcome, Senator Hayes, to HGO.
Thank you, Madam Chair. Glad to be back. And I will be very brief. We're in an active voting session where both cannabis bills are in jeopardy without my attendance due to some illnesses on my committee. So I'm keep on getting text messages from the president's office to come upstairs. So I will be very briefly. Senate Bill 250, you already heard the cross-file 325. There's some slight changes, whereas the Senate bill eliminated the grace period, as well as there's some additional study language for DLS that the Senate put in the bill. I will leave it up to the committee to figure out which direction you guys wanted to go, but the bills are very similar, and I'm grateful for you all support and urge a favorable report on Senate Bill 250.
Thank you, Senator. Are there any questions for the Senator? Okay, seeing none, that concludes the hearing on Senate Bill 250. Senator Hayes, want to go fast on Senate Bill 607, Health Equity Resources Communities Modifications?
Yes, ma'am. This will be extremely quick. Thank you, Senator Antonio Hayes, for the record. Thank you, Madam Chair and members of HGO. This bill is in the same posture as the House bill. It simply makes some clarifying amendments to the HERC Commission, which I'm so grateful for you all support and getting that done last year. I urge a favorable report.
Thank you, Senator. Any questions for the Senator? Seeing none, that concludes the hearing on Senate Bill 607. Back to voting, Senator. Thank you very much for making us a little time for us. The next bill is Senate Bill 859. This is Senator Watson. It's Public Health Sickle Cell Disease Registry Establishment. Senator Watson.
Senator Watson is not here.
He is not here. Okay. This was a cross-file with Senate House Bill 1176. I'm not sure who the sponsor was. I believe it was someone on HGO 1176.
It was Delegate McComas.
It wasn't on HGO then. And do we know what the House posture is at this point on 1176?
Yep. This is Aaron's bill, but it looks like HGO has not voted it. And I believe it went in Public Health Subcommittee, and those folks are also not here.
Right. Okay. So, we will wait until we see what happens in the subcommittee today, and we'll move. So Senator Watson is not here. We have, I'm going to go to Senate Bill 5, which is Senator Patterson. Is Senator Patterson or his representative here?
Senator Patterson is also not here.
Okay, that is
on the way. Delegate Coulson?
Yes.
Even though Senator Watson is not here for Senate Bill 932, the cross-file bill is House Bill 1439, which I sponsored.
Okay.
And I asked Chair Pendergrass to pull it. It was actually sitting in the Rules Committee, and she pulled it today because I wanted it to be heard. So.
Okay. Do you want to?
Well, I'll speak to it briefly. They're both identical.
Okay.
And what it is, the purpose is to authorize the city of Bowie to participate in the Maryland Interstate Emergency Management Assistance Compact. And what it does is the compact actually provides for emergency management mutual assistance between jurisdictions that are a part of the compact. It allows any jurisdiction in Maryland to request and receive assets from another Maryland jurisdiction through the coordination of the Maryland Department of Emergency Management. And as part of the process, parties collaborate on requesting procedures and financial and liability issues It also provides for mutual cooperation in emergency management related exercises, testing, and training activities. Currently, all 23 Maryland counties, the city of Baltimore, the city of Annapolis, and the city of Ocean City and Laurel directly benefit from the Maryland Emergency Management Assistant Compact. And I want to point out that the only other municipalities within the state with full-time directors and programs that are not a part of the compact are in fact the city of Bowie and the city of Rockville. So that's what the bill does. It authorizes the city of Bowie to participate in the compact.
Hi. Are there any questions on Senate Bill 932, House Bill 1439? Okay, thank you very much for pinching in there, Delegate Landis, and we will that will conclude the hearing on Senate Bill 932. And is Senator Patterson here yet?
Yes.
Okay.
Yes.
All right, Senator. So we will begin the hearing on Senate Bill 5. This is Senator Patterson. General Provisions Commemorative Days, Tuskegee Airmen Commemoration Day. This is a cross-file bill, and I believe passed the House unanimously. So, Senator Patterson.
Good afternoon. Thank you, Madam Chair, and thank you so much for the opportunity to briefly tell you a little bit about Senate Bill 5. I think your committee might have acted on this bill. I'm not sure, but I'm delighted. I'll come back tomorrow if you need me to. I'm so excited about this piece of legislation. Let me tell you, because it's an opportunity to showcase some of the great accomplishments of African Americans who have made a great contribution to keep us all safe and sound in this country. So this bill is just to establish a commemorative day for those individuals, to recognize them, thank them for saving us, so to speak. And it will be a day, March the 4th, Thursday in March. We have about 8 other states and one pending who've already enacted this initiative. I could give you those names, but I would just tell you in the local areas, Virginia, DC, Colorado, which is not in this area, but it's a total of 9. And we wanted to put this into action, make it official so that we could share it with our youth and our schools to let them know the great work that this particular group had done for this country and this universe. And that's basically the summary of the bill. Be happy to entertain any questions if you might have it, but we hope that you will again give this bill a favorable response.
Thank you, Senator. Are there any questions? Are there any questions? Oh, I'm sorry. Go ahead.
I was about to say, I think this is my first time officially before this committee, and it's great to see all of you, and thank you for what you do.
Welcome, and we're glad you could be here today. Delegate Johnson.
Thank you, Madam Chair. I just wanted to remind that was unanimous in the committee and on the floor.
Yes.
Thank you.
Thank you. Thank you very much, Delegate Johnson, for reminding us of that. And thank you, Senator, for the bill. That concludes the hearing on Senate Bill 5. And I understand that Delegate Watson is here now. Is that correct?
I think he left for today. I think somebody.
Senator Watson.
Senator Watson.
Oh, Senator Watson.
I'm here.
Okay. Senator Watson, you're here?
Yep. Which bill you want me to start with?
So actually, Delegate Landis did a really nice job of presenting Senate Bill 932 and House Bill. So, but if you want to add a little bit, but we would like you to present on Senate Bill 859, Public Health Sickle Cell Disease Registry Establishment.
All right, let's talk 859. So this bill requires the Maryland Department of Health to establish and maintain a registry of individuals diagnosed with sickle cell disease for the use as a single repository of accurate, complete records to aid in promoting the sitting of certain health care providers in the areas with statistically high populations of individuals with sickle cell disease, and requiring the department to periodically publish information identifying areas with statistically high populations of individuals with sickle cell. It's my understanding that the House has seen, I think, 4 bills related to sickle cell. There was one amendment to this one was to ensure that the registry was integrated with the state designated health information exchange. That's pretty much the bill in a quick summary. There are many, many people in the state of Maryland who are diagnosed with sickle cell, but there are very few trained hematologists in the state. None are in Hartford or Cecil counties or rural counties of the Eastern Shore. And the Eastern Shore has more than double the populations of sickle cell disease patients than Hartford and Cecil. Currently, many people have to travel to Baltimore, Delaware, Washington, D.C., and Virginia for expert health care. So this bill seeks to get the information needed to ensure that we have these trained professionals provided statewide to help with this serious disease. With that, that concludes my testimony. I urge a favorable report for 859.
Thank you, Senator. Are there any questions for Senator Patterson on House Bill Senate Bill 859?
Well, Senator Patterson's gone, but Senator Watson can answer some questions.
All right, Senator Watson. Sorry.
Okay.
I
That's
apologize,
okay.
Senator.
No, thank you, Delegate Colson.
Seeing no questions, that concludes the hearing on Senate Bill 859. Thank you, Senator Watson, for coming.
Thank you very much.
And we are going to move to the last bill, which is Senate Bill 788. This is Senator Feldman, Cannabis Regulation, Medical Cannabis Definition and Study. And is Senator Feldman here, or is a representative?
Sorry, I'm here.
Yeah.
Good afternoon, Madam Chair and honorable members of the Health
Mr.
and Government Operations Committee. Thanks so much for having me today. My name's Alec Bergman. I'm a legislative intern for Senator Feldman. Senator Feldman wants me to express his deepest apologies that he's unable to attend today. He's currently in the Finance Committee working on bill hearings too. And so he asked me to present Senate Bill 788, the Medical Cannabis Definition Study Bill. As currently amended, the bill authorizes the Natalie LaPrade Medical Cannabis Commission, the State Department of Agriculture, and the Maryland Hemp Coalition to conduct a study and make recommendations on how to best classify and regulate THC derived from the Delta 8 and Delta 10 strains. The hope is that these recommendations will help address a potential problem in current law that allows these strains to go mostly unregulated and freely sold. Senate Bill 788 unanimously passed the Senate Finance Committee and was unanimously passed by the Senate. Senate Bill 788 was cross-filed with House Bill 1078. The two bills both greenlight the study to determine the classification and regulation of Delta 8 and 10 moving forward. House Bill 1078 also includes a provision that would restrict the sale of any product that contains Delta 8 or 10 to individuals under the age of 21. Senator Feldman wants me to convey that he's happy to reconcile his bill with that of the House and adopt any differences between the two bills. As you likely remember, House Bill 1078 received overwhelming support by both your committee and the Judiciary Committee, and it was unanimously passed by the House as well. Senator Feldman asked for a favorable report on Senate Bill 788, and I just want to say thank you so much for having me today. It really is an honor to be here.
Thank you for being here, Mr. Bergman, and helping your senator out there. And you answered my question in terms of whether or not there's a willingness to work out the differences between the two bills at this point. And I heard you say that.
Definite willingness, definitely.
Great. Are there any questions on Senate Bill 788? Seeing none, that concludes the hearing on Senate Bill 788 and the work before this committee today. We will be going on back to the floor of the House of Delegates at 4:30 today. And as I started off with, please stay aware that the schedule is a little fluid in terms of scheduling of hearings and subcommittees. The Insurance and Pharmaceuticals Committee will be meeting tomorrow afternoon, not today. And but follow on the website for any changes in time.